Welcome to our new season of Breaking Stereotypes. I'm your host, Kristy Ramnarine. During this season, we're going to deal with a topic which, you may have seen some stuff about it on social media, but it's something which a lot of people do not speak about, and that's menopause. And right there with it is perimenopause. And here to talk some more about these topics with me is Dr. Sherene Kalloo. I call her the baby whisperer, baby deliverer. She delivered my 4 babies. Welcome, Dr. Kalloo.
Thank you. Thank you for having me, Kristy.
Dr. Kalloo, I'm going to go straight into it. It's topics which you're hearing some more about now, but traditionally you didn't hear a lot of talk about perimenopause and menopause. What's the difference in the both? What are they?
Sure. So it's about a definition. Menopause itself is when a woman reaches a point of not seeing her menstrual cycle for a consecutive 12 months, after which she's considered postmenopausal. So any bleeding after the menopause is considered abnormal. So that time frame when she stops seeing her menstrual cycle is called menopause. Mm-hmm. However, leading up to menopause is what we call perimenopause, where we start feeling and seeing symptoms of menopause and perimenopause, which would be a host. You could probably count 40 different symptoms and even more. The hot flushes, the tiredness, the irritability, the ringing in the ears, things you can't even explain before. And this can happen from as early as 35. So, wow. 35, yes, we have women who go into menopause. These studies have shown that 1 in 100 women actually hit menopause before the age of 40. But our general population, menopause is between 45 and 55. Mm-hmm. So the symptoms before that, which I would have started talking to my patients from the age of 40 about the symptoms to expect for perimenopause and what to do.
Well, at 40, I was having the twins on a table.
Yes, correct. You defied everything else.
And then, right after having the twins, I started getting pain under my feet. Plantar
fascia.
Yes,
I remember.
I'm going to let you pronounce it. And then, after having that pain in my feet, I realized that my monthly was very heavy. I came for a checkup, and everything was fine. I'm going to let you talk about the results of that checkup that I had.
So you give me permission to divulge your personal information.
I am.
So basically, in your particular case, you would have had irregular periods starting to take place, and then random symptoms that physically, when you rule out, you x-ray, you did whatever, we couldn't find a cause. Now, if we did blood studies which would indicate the hormone levels, at that stage, we still would not be able to make the diagnosis. So therefore, the diagnosis is made based on symptoms. And this is why awareness and knowledge is so important for women to know. We're not saying all the symptoms we call out are related to menopause, but you still have to rule out pathology before you reach to that conclusion.
Yeah.
So in your particular case with the irregular heavy period, looking at the ultrasound, not finding any abnormalities, you do hormonal studies and they're all normal. We then bring it down to, okay, we're having perimenopausal symptoms.
Okay, and I want to talk some more about the irregular period, because this is something that a lot of women actually have to go through. I've had in the last year cases where I came to work and I messed myself, which never happened in the past. Quite embarrassing.
Yeah.
And also with it, fatigue. I'm a non-stop Energizer bunny, always on the move.
We know that.
Always on the go. And now I am tired when I have my monthlies.
Yeah.
And, this is something that I'm also hearing other women complaining about.
And this is why talking about it is important. So you raise awareness for other women to be knowledgeable of the fact that these are symptoms. So period irregularities can mean, for some women, your periods just stop coming. It starts to get lighter. It comes whenever it feels to come. It may take a few months to come, or it may come more frequently. And then you have what you call menorrhagia, which is what you're describing, where your period is extremely heavy and you get flooding, which is where you mess yourself up, which is embarrassing. So I remember those days for me as well. I had a period of time where I also had very heavy period. My resolution to that, and I'm not ashamed to say, was I could not go to work with just pads on.
I'm smiling because we had this conversation before.
We did, yes.
And you also told me that I should try it.
Yes, and you know what I'm going to say?
Yeah.
It's nobody knows that you're wearing pull-ups. You wear the adult diapers and you keep yourself clean. Yes, you're bleeding heavy. Yes, you use your vitamins. Yes, you can use hormonal treatment as well, which we'll talk about.
Yeah.
But these are things that you can do to not embarrass yourself, because then you're afraid to go to work, or you keep checking yourself to see, you know, what's happening, or you have to rush into the bathroom, and it really messes your life up. So these period irregularities are manageable to some degree, but they are expected. So you're not supposed to sit at home and say, oh, that's normal, I'm not going to do anything about it, and you just live with it, because you can become anemic. So after periods of bleeding, your blood count is going to drop to a point where you start getting tired, fatigued, short of breath, chest pain, and these are things that you cannot allow to happen, because you can get heart problems.
Yeah, and you also have 4 children to take care of.
So you
while
have that at work, right?
Yeah.
Yes.
And this is just my case. You know, every woman, of course, is different. But these are things we don't usually speak about. And I want to go now to menopause. The big M. The big M that a lot of women do not speak about. Why do you think women they shy away from the topic of menopause?
So interestingly, there was a study done, and it was found that in the Caribbean especially, it was taboo to talk about menopause. And I feel that a lot of it is because of the stigma attached with society, thinking that you've reached an age where you're now considered older and unable to achieve a lot of what we still do achieve, even postmenopausally. But at that point in time, it was all about sexuality, vitality, everything was aligned to menopause. So women did not come out to talk about it, because as women, most women, I know you don't, it doesn't matter to you, but people do not like to say their ages.
Yeah, I have no problem.
I know that. So do I.
I just said I had the twins at 40, so
exactly.
even if I did,
work out the math, right? So it is about the stigma attached to it, and also society accepting the women who are menopausal.
Yeah.
So all of this, I think, a lot of destigmatization has been taking place over the years to compensate for all of this, because we as women are working more, we're independent, we're in society trying to achieve and achieving what we need to. So these are myths and taboos that we need to just get rid of.
Now, let's talk about the symptoms. What signs would you usually get if you're going into perimenopause?
So we spoke about one already, which would be the period irregularity. And you spoke about tiredness.
Yeah.
So that's 2. And then you spoke about your plantar fasciitis. So you're a prime example.
What is going on here?
And these are some of the symptoms. Most patients complain about hot flushes, tiredness, irritability, vaginal dryness, problems with sexual intercourse, genitourinary problems with the urinary pus in the urine, incontinence, recurrent infections, yeast infections, headaches, tingling, ringing in the ears. There are a host of symptoms that we can align to menopause and perimenopause. Perimenopause being the most important thing here right now for conversation.
Yeah. And, you know, so that ringing in the ears, it did happen to me. And I didn't take it on because I was like, you know, it's only because I'm reading more and more about perimenopause.
You're getting the signs, yeah.
Yeah, but you just hear this buzz in your ear.
Correct.
And also the itching of the ear, I think that is also another sign that I read up.
It has been documented.
Yeah.
Yes. And if you keep reading, you're going to be able to read pages and pages of symptoms that people complain about.
You know, so my biggest question is, how do women go through this and people don't even know? You know, and it's a lot. Again, traditionally something we didn't speak about in the past, but it's a lot to have to go through in terms of changes with your body.
Correct. Yes. And it is a problem not just for the women. As I said to you earlier when we were speaking, it is a problem for the men as well.
Yeah.
Because men need to understand what women are going through. There are many marriages that break up because of menopause and not being able to understand each other anymore. People have struggled through and they have been successful. There are people who do not get the kinds of signs and symptoms we're describing and they have no problems. But the ones who do, yes, they do struggle. But it's important to note that basic lifestyle changes makes a huge difference to how you feel. And this should not start when you start getting the symptoms. You should start making those changes before 30.
Yeah.
So when you do that, it flows. When you hit perimenopause and menopause, you don't feel these symptoms as much as. So it's all about eating properly, exercising, no smoking, no alcohol. There are supplements that we do recommend, evening primrose oil capsules. So those are the kinds of things that we'll recommend before deciding if a woman needs to have hormone replacement therapy.
Okay. Now we're talking about the symptoms. Can perimenopause or menopause affect a woman's mental health?
Oh, yes, definitely. That is an important point. Depression, anxiety, and the irritability that we mentioned, they all come into to play with mental health. So it is a big problem, yes.
Okay. Now, before I ask that question, you spoke about the hormone treatment. And you revealed to me that you personally started that treatment. Can you tell me a bit about your personal journey with menopause and how come you came to having to take the treatment?
Sure. So for me, revealing my age is not a problem either, okay?
I can give you a high five for that, yeah.
And it doesn't, I think 60 is a new 40, okay? So I had perimenopausal symptoms, not as bad as, because as you know, I'm an Energizer buddy too. I don't stop.
Yeah.
Nothing can stop me.
I was now going to say 60. How many babies have you delivered?
Well, you know me as a baby deliverer, right? So up until 2023, I had counted up to 10,000.
Wow.
So 11,000, sorry. 11,000, I'm still counting.
Yeah.
And that was in November of 2023. So I'm over 11,000 and happily still delivering babies. So don't let my age fool you, okay? Still running around doing what I need to do, but it keeps me happy.
Yeah.
And I don't know, maybe the hormone replacement therapy made a difference, but perimenopause started for me as well, but mostly the hot flushes. I must say, not tiredness was not a problem for me, but the hot flushes became a problem. I think I became irritable as well. I was snapping at my children, and my husband, but not...
I like how you just fit that in there.
But not at work. Work was always my happy place.
Yeah.
So that wasn't a problem, but having a good night's sleep is important. And insomnia is a problem with menopause as well. So the hot flushes, you don't sleep well. You're flinging the sheets off because you're feeling hot at one point, and you're pulling it back over because you're feeling cold. So it wakes you up. So that and the irritability became an issue. I went through still without hormone replacement because, as you would probably know, there was a study done about 20 years ago by the WHI, the Women's Health Initiative, and it was not conclusive, but we were following it for a while as doctors. And now we're realizing a lot of it had to be thrown out.
Yeah.
And this is why hormone replacement has become a replacement now. So I hit menopause when I was 57. So it took a while for me to stop seeing my period. And for all the ladies out there who think that they're going into menopause, it was like 56. And I thought, okay, this is it. And 11 months went by, and then, bam, you got a period again. So you had to start counting all over again because it's 12 months, consecutive months. So that took me until 57. And last year, when I was 60, that's to remember my age because I said 60 to 40, right?
Yeah.
That's when I decided to start hormone replacement therapy based on my research and checking what would be beneficial for me. And my life has changed, and I have been able to recommend to patients the ones who would benefit from it using hormone replacement. However, getting hormone replacement therapy in Trinidad is very difficult. All we have are tablets. We get vaginal creams sometimes. So maybe the Minister of Health, if he's listening to this, can make sure, and he's a gynecologist as well. So we could ensure that the women are taken care of in this country by finding other means of treatment, patches, creams, etc., to use for our menopausal patients.
Okay. Now, you said it's hard to get the treatment in Trinidad. What is the treatment?
The treatment options we have available right now are tablets. We do get the vaginal creams off and on, but it's not readily available. So there are patients who we would use the vaginal creams on if they have like localized issues, you know, the dryness in the vagina or recurrent infections, and it works fine for them. So you get a lower dose of estrogen being absorbed into the body as opposed to putting patients on tablets. Now the patches are the best option because they have a lower dose of estrogen being absorbed and you bypass the liver. But if we only have the tablets available, that's all that we can use.
Yeah.
So that's what we do use. So we have the hormone replacement therapy available as an estrogen and progesterone tablet. Because with menopause, what happens is the estrogen and progesterone levels starts reducing from as early as 35, 40, perimenopause. And those levels reduce until it reaches that very low level where the period stops coming.
Okay. Are there any side effects from using this?
My personal ones?
Yeah.
So I don't have any, thankfully, but there are documented side effects. And this is why a lot of patients will not go on hormone replacement, because with Google, you read too much, you put too much into it, and you have to weigh the pros and cons with everything. You have to see what's beneficial for the patient and which one is going to be the better outcome for them. So maybe headaches, blurring vision, mood swings as well. People ask if you gain weight with a hormone replacement. The weight gain is actually a symptom of menopause. So being on the hormone replacement actually fixes that. So the weight gain is not so bad. And then, of course, you have the big long-term issues that they talk about: breast cancer, strokes, heart attacks. Breast cancer has not been proven to be a big risk factor with hormone replacement therapy. We thought so. And this is why we would not put patients on it. But the studies have not conclusively found that there is a relationship with breast cancer. So we still tell our patients, yes, you need to examine. It depends on the type of breast cancer that would develop. You do your examinations, you do your mammograms, you do your tests. But if your life is so miserable that you're unable to function, then of course hormone replacement is the answer for you.
You know, I keep reading that going through perimenopause and menopause, it's a transition and not basically a symptom of something medical. However, during this transition, there are so many changes that a woman has to go through, which can affect that woman's ability to function in a workplace, to function as a mother, to function as a wife, and whatever. in whatever else or capacity the woman needs to function in. What is your take on this?
It is considered a transition period, I agree, because it's the transition of perimenopause into menopause, which is not just a cessation of a period, but it involves all of these symptoms that we are speaking about right now. And, well, you know, women have problems and they hide it very well and they continue to function. So we are built differently and we are able to function normally without having any issues to deal with outside of that, because we know we have to do it. But there are women who are unable to function completely and they do suffer very badly. Even though you have maybe depression, you could put a smile on your face. Nobody's going to know what you're dealing with. But once you are able and capable of fulfilling your job and being able to function in your workplace or at home, then nobody knows what you're dealing with. And unless you can now come out and talk, maybe a friend, maybe someone else who's going through the problems you are, or you go to your doctor or a therapist, then you will be able to have that guidance to know how you are to cope with all of these symptoms you're describing, the transition period, as you call it.
Yeah. Do you think women are afraid of speaking out as well because of how they would be seen in the workplace?
Most definitely, and that is one of the issues of this being a taboo, because they're now considered at a certain age where they're not going to be able to perform as they would have been able to perform before. And this is why women don't speak about it, because they're going to be judged. And they take whatever they have to and they work with whatever they have to until it just can't happen anymore. And then we see them appear at the office with problems.
Yeah.
But definitely.
How do you personally deal with balancing your, family life, work life, and dealing with postmenopause?
You know, I think I have been blessed in life because I've always been able to balance everything throughout my years of my career and life. And having someone who understands what you're dealing with, it is important. So your partner is important for you to be...
Even though she gave him
half
of a mention before.
Well, yeah. But it is important. As I said, I have been blessed. I have not had ridiculous symptoms. I knew what my symptoms, as a doctor, I knew what my symptoms would have been and how to cope with it. And also at what point I was able to put myself on hormone replacement to be able to cope with life. And I guess that's what makes it easy for me. Time management is important. I have schedules on my phone for everything, a timer, so that you know, okay, I'm also diabetic. I think you know this, Kristy. I take insulin.
Yes. Never take cookies for doctor or anything sweet.
No chocolates, no alcohol. We'll take the gift vouchers. Yeah, because I'm on insulin as well. So I set a timer. It works beautifully. Every night I know I have to give myself this insulin. Yes, you get brain fog as well. With
the brain fog. I keep telling people I'm still going through, how you call it, pregnancy brain, whatever you call that.
Yeah, the pregnancy brain fog.
I feel like I forget all the time things that I should remember. I forget.
It is
only
a part,
to read that it is
a part of the symptom. Exactly so. But how you cope is not just about taking medication. It's also about putting things in place for you to learn how to cope. So that's why I said having a timer works for me.
I'm laughing because growing up, I remember when my mother would call. I have 2 sisters.
Yes.
And she'd call everybody else but you. She's looking at me but calling my other sisters. So I started doing it with the children. And one day I'm on the phone going through perimenopause, and Zara's with me, and Zara's like, no wonder why you're calling me a manny.
Oh.
And Zara
figured out the diagnosis.
Yeah. She's like, yeah, you have perimenopause.
There you go.
Yeah,
And
because
you're teaching her from young.
you know, but it is so what's the word I'm looking for? Things that we go through on a daily basis that
From
we
home.
take for granted.
Yes.
And you think this is just part of life when really and truly it is, or are,
Transition.
yeah, symptoms of this transitionary
Correct.
period.
Correct?
Yeah.
It is, and that's how we have to interpret and understand what it is all about. It doesn't have to change your lives completely.
Yeah.
You know, you adjust to suit and you continue to do what you're capable of.
I want to go beyond the symptoms and talk about how menopause could affect your heart and also bone density.
Yes. So those are classic, those are long-term, what we call long-term symptoms of low estrogen levels. So women who are menopausal are known to be more at risk for heart disease, strokes, and also osteoporosis, which is a reduction in the bone density.
Yeah.
It's more common in the Caucasian population, but we still do see it in our population. And these are tests that we do recommend for patients to do, usually by the orthopedics people, because there are treatment options for symptoms as well.
Okay. And we probably just have like 3 minutes left, but I saved the most important question for last. You mentioned this before, but I'm going to ask for you to go a bit more in depth in it. How is a woman's sexual health affected by menopause? I know it's something a lot of people don't like to talk about.
I was just about to say that because it is a taboo as well to speak about sex, but people are more open about speaking about it now because if it's affecting your relationship, you want to fix it. So sexual intercourse is, first of all, libido is less, meaning that your drive to want to have sex becomes reduced when your estrogen levels drop. Now, there are few women who actually have an increase in that drive in menopause, which is rare. The vagina becomes dry, so we interpret it as pain. Don't touch me because I'm going to have pain.
Yeah.
And men get turned off. They don't understand. I don't want pain. So, of course, that causes friction in the relationship as well as with sex, okay? So the pain is what we call superficial dyspareunia, which is on entry because of that. And there are lubricants that you can use to improve that. Because of that problem, it now causes problems in relationships. And this is where it gets to the point of people reaching a divorce because of menopause. And intervention, lubricants, going to your gynecologist to make sure everything is okay, using hormone replacement therapy if that becomes a problem. Those are important interventions for patients to be able to know it's available, it can be fixed, and it's okay to come and talk about it. We're not here to judge you. We're here to help you. So come, talk about it. If you think you have a problem, talk to your partner and tell your partner, this is what is happening to me. Please try to understand and let's work on it together. So it is a real problem, and it is something that can be not completely 100% fixed, but of course, there are treatment options.
You know, Dr. Kalloo, I'm sure when this episode airs, there are going to be a lot of women with plenty questions about this topic. How can they reach you? I'm putting you on the spot.
You did put me on the spot. Social media, Instagram, Facebook, and of course, you can reach out to my office and St. Augustine Private Hospital, which is where I'm based.
Okay. Any final words before we wrap up?
I would say to women who are experiencing any of the symptoms that we've spoken about, don't let it get to you because there are treatment options. Be open about it, be aware of it, and come to your doctor and have a conversation and let you and your doctor and your partner make decisions about what is the best step forward.
Thank you so much for coming on Breaking Stereotypes and sharing with us. Of course, I'm going to bring you back on later in the season to speak some more about this. There are still so many topics: diet, exercise, fitness, mental health.
Sure.
so many different things.
Specialties that
exactly,
you have to,
which
yes.
all falls within the menopause, the big M topic.
Correct, and we call that a multidisciplinary approach to management of a patient. Thank you for having me.
Thank you. That's it for Breaking Stereotypes. I'm your host, Kristy Ramnarine.